Hey there, Empowered Tribe. It's Angela T. Moore. You're getting ready to experience the next episode of Empowered, a health and wellness podcast where I share my personal journey of health and healing, tips for mental and physical health, interviews with health and wellness experts and those bold enough and vulnerable enough to share their own journeys to empower you to succeed in yours. We know that life can be rewarding. It can also be challenging. It has its ups and downs, highs and lows. I learned that with a strong mind and a fit body, you are better able to grow through and grow from whatever life throws your way. My goal is to share journeys of health and wellness, as well as tips and information from extraordinary people all around the world to help you live an empowered life. My guest, Michael Stack, is the founder and CEO of Applied Fitness Solutions and the Michigan Moves Coalition. He is a faculty lecturer for the University of Michigan School of Kinesiology. He is also the creator and the host of the Wellness Paradox podcast, produced in conjunction with University of Michigan. Michael is an exercise physiologist by training and a health entrepreneur, health educator, and fitness industry advocate by trade. He is dedicated to the policy and system changes to ensure fitness professionals become an essential part of healthcare delivery. With a career spanning over 3 decades in fitness, health, and wellness, Michael has a deep knowledge of exercise physiology, health and wellness coaching, lifestyle interventions to mitigate chronic disease, and leadership. In this episode, Michael and I discuss his amazing journey from an overweight high school student to a health entrepreneur. He emphasized the need for policy and system changes to integrate fitness professionals into healthcare, comparing it to the professionalization of dietitians and physical therapists. Michael expands on 3 key initiatives: programmatic accreditation, professional registration, and continuing education. We discuss the high turnover rate in the fitness industry due to low pay and the need for sustainable compensation models. We also have a frank discussion about the importance of shifting from a volume-based to a value-based healthcare system, viewing exercise as a fundamental health intervention. Ultimately, discussion highlights the critical role of movement in health and the need for equitable access to healthcare services. I hope you enjoy the episode. Michael, you are the founder and CEO of Applied Fitness Solutions and the Michigan Moves Coalition, a faculty lecturer for the University of Michigan School of Kinesiology, as well as the creator and the host of the Wellness Paradox podcast. You describe yourself as an exercise physiologist by training and a health entrepreneur, health educator, and fitness industry advocate by trade. What can you tell me about your background and how did you get to where you are today?
Yeah, I think my background is somewhat unique for a traditional exercise professional. Really, the start of my story is in high school. I was a really overweight kid in high school. I graduated high school at about 275 pounds, which is 100 pounds more than I am right now. And honestly, when you're the different kid in high school, it doesn't matter if you're the fat kid or the skinny kid, the tall kid, the short kid. When you're different, you're picked on for being different. And I was picked on for being the fat kid in high school. And I think a lot of people understand that experience. And that's what really got me into exercise. We found a little YMCA gym in Westland, Michigan. My mom and I, this is, circa 1993. So most gyms in 1993, you have to be over the age of 18 to work out in. Now Planet Fitness gives free gym memberships to every high school kid in America. But back then, working out at a gym was almost exclusively 18 and up. But my mom and I finally found this little YMCA gym. I found a guy there that mentored me. And I often like to say he gave me access to this environment it was safe. It was inclusive. It was welcoming. And it was the first place where I really felt that I could be socially myself, which when you're 13, 14 years old is probably what you care about more than anything else. And I didn't really realize it at the time, but that set me on a trajectory for the rest of my career that would be trying to pay back what that little YMCA gym and that mentor gave to me, which was to provide access to inclusive, safe, welcoming environments for people to move their body in a way that not only improved their physical health, but their mental and their emotional health as well. And so it's been now over 26 years in the industry, trying to, pull that mission forward, first as a individual exercise professional, then as a business owner, then as a university professor. And now I spend a fair amount of my time in the policy and systems change space, trying to allow the environment, broadly speaking, to evolve to allow more people to be physically active.
Mm-hmm, mm-hmm. Now, I learned in my research and preparation for your interview today that you are very dedicated to the policy and systems changes to ensure fitness professionals become an essential part of healthcare delivery. And you kind of alluded to that in your response. Can you talk about the work that you do as it relates to policy and systems change?
Yeah, absolutely. And I think, this is a policy and systems change, first off, can be a foreign concept for some people. So I think it's important to start by defining that, and then we could talk a little bit about the work I do. We are influenced in this country all the time by the governmental policies that are in place. You have it be policies at the local level, the state level, and the federal level. And those policies really put structures and systems in place that act as guardrails for how our society operates. And, that is certainly true in the healthcare space. The fitness space in and of itself is not very regulatory heavy, but if fitness wants to do what it can do to improve population health, it really needs to move into the healthcare space. So I do some work on the state level, but most prominently on the national and federal level with what's referred to as the professionalization effort in the exercise profession. And essentially that is getting highly qualified exercise professionals to be considered qualified healthcare professionals. So an analogy that I can use is a registered dietitian is considered a qualified healthcare professional. They're underneath the healthcare tent. They can get referrals from healthcare providers. They can bill insurance. That doesn't exist in the exercise profession right now. And just like dietetics went down its professionalization path, physical therapy did, athletic training did, the exercise profession is undergoing that right now. And that pulls together the policy and systems change work of a number of different organizations. Two that I'll mention that are most prominent. One is the Physical Activity Alliance, which is the nation's largest group of physical activity stakeholders. That organization, which I'm on the board of and president-elect for, we are working with federal agencies and we are working with federal policy to try to embed exercise testing, prescription, and referral as a standard of care in healthcare. And that's the Physical Activity Alliance's It's Time to Move initiative. So again, we want to make physical activity assessment, prescription, and referral the standard of care in healthcare. And that's one piece. And then the American College of Sport Medicine is a group that's leading the charge on the professionalization of the exercise professional. So at the end of the day, if the Physical Activity Alliance is successful in making assessment, prescription, and referral the standard of care in medicine in this country, there has to be a accountable and qualified healthcare provider in the exercise profession to be able to accept those referrals from healthcare and perform supervised exercise therapy. That is a framework that I think the ACSM is really working to advance through their credentialing program, particularly their ACSM exercise physiologist credential. It seems like with the work that's happening right now, that seems like that will be the reimbursable qualified healthcare professional that is an exercise professional. So that stuff can sound very wonky, but essentially what we're looking to do is we're looking to get someone in the exercise profession who is highly qualified, meets certain competencies and standards to now become part of the healthcare profession to be the accountable provider for physical activity and exercise in the healthcare ecosystem.
Mm-hmm. Now, you wrote an article titled Professionalizing the Exercise Profession, What It Means and Why It Matters. Now, I think you've gone into it somewhat, but there were some key points that you expanded on within that article. So can you explain the professionalization effort in the exercise profession and why is this important and what is actually happening?
Yeah, and so that article that you're referencing is part of a larger journal issue that was published by the American College of Sport Medicine this past September, and it was an issue on professionalization and advocacy. The ACSM brought me in to be the guest editor for the issue, so it was my responsibility to develop the content outline, source the authors, edit the articles, with the goal of kind of developing a one-stop shop for not only the exercise profession, but also policymakers and individuals that are part of healthcare to understand what we're doing. And in the issue introduction article, I laid out some of the important factors. First, the why, and then the critical pillars of what needs to happen to make this a reality. And put very simply, on the level of why, at this point, there is no accountable provider in healthcare for physical activity and exercise. If you think of all of the lifestyle interventions that can be implemented to improve health, have it be sleep, nutrition, improving your mental health, you go down the list, there's an accountable provider in healthcare that is responsible for that. There is no accountable provider in healthcare that's responsible for physical activity and exercise. And the why to professionalize the exercise profession is that we know that on a minute-by-minute basis, physical activity and exercise is the most potent thing you can do for your health. If you think about it, 150 minutes per week of moderate to vigorous intensity physical activity allows you to meet the guidelines set forth by the World Health Organization and the CDC. There's no other health behavior that if you only engaged in it for 150 minutes a week would allow you to derive any kind of a health benefit. If you only ate healthy for 150 minutes a week, you certainly wouldn't be eating that healthy. If you only slept well for 150 minutes a week, you wouldn't be that healthy. Exercise and movement is such a potent intervention. And the fact that we have no one accountable for it in the healthcare system is one of the reasons I think that we struggle with physical activity levels so much in this country. Now, you asked about the kind of the critical elements to it. And really, there's three key components to this. And I don't want to dive too deep into this. The article is an open access article on the internet. You can certainly post it on your show notes page for your listeners to be able to get access to. But there are really three layers to this. Layer number one is something that's referred to as programmatic accreditation. And that is accrediting the academic programs around the country that educate exercise professionals under a uniform standard. Right now, in the exercise profession, I teach at University of Michigan. If you took classes as an exercise science student at U of M, your curriculum would look slightly different than what it would look like at Eastern, Michigan State, Texas, and so on. If that occurred in any other healthcare profession, it would be very difficult for healthcare providers to be able to trust that the other healthcare professionals were learning what they needed to learn at the academic level. And so we're at a point right now where we're looking to accredit academic programs under a set of specific standards. So that's plank number one. Plank number two is something that we refer to as professional registration. And in healthcare, I'm sure everyone's familiar with the concept of licensure. Licensure just doesn't exist in healthcare. It exists in multiple different fields, and it's a regulatory instrument. What we're starting to see is that the federal government in particular is really moving away from licensure because it actually causes portability issues from state to state. A great example right now is in the nursing profession. There's widely a nursing shortage in this country, and one of the reasons it can't be fixed quickly is because if you're licensed in Michigan, in order for you to work in Ohio, you have to be licensed in Ohio. Now, they're trying to work around that, but we're trying to learn from what other professions have seen with regard to licensure. And what we've developed is a framework for professional registration through the Coalition for the Registry of Exercise Professionals. So the second plank of professional registration is if you are certified or credentialed by one of 5 organizations, you become a member of this registry. And being a member of that registry basically says that you have achieved the minimal competency for being a qualified exercise professional. Now, certainly we want our exercise professionals or any healthcare provider to be more than minimally qualified. And that's where the last plank of this comes in, which is the continuing education element, which is ensuring, and this works back to the registry, it's ensuring that qualified exercise professionals who start on that registry when they receive their credential continue to stay current with their credential by doing continuing education. So we have three planks, three legs, if you will, to the professionalization stool. One is programmatic accreditation. The next is professional registration. And then the final one is appropriate continuing education. And that is the path we are on right now to ensuring that, again, qualified exercise professionals become qualified healthcare professionals.
I love that. We remember when you and I spoke some weeks ago, one of the things that I shared was my frustration when I have been categorized or put into a category of other trainers and other wellness professionals that don't have the certifications, the specializations, the master's degrees that I have. And I will say that is something that I definitely became aware of when I acquired my master's in order to become a therapist, was that there were specific standards and guidelines that had to be met in order for me to do that. And there are still those standards and guidelines that have to continuously be met to maintain, my license in the state, for instance, in the state of Michigan. And I do have the ability through a series of steps to make it so that I can perform my services in other states. So that's very interesting that is something that you guys have recognized, that can be problematic if you're only limited to performing a service in one state and you move. If you have to go through hoops or you even are unable to provide those services in another state, then you're basically denying access to the people within that state that could benefit from your service.
Yeah, and here's the thing. The professionalization in the exercise profession is no different than what's happened in any other field within healthcare. The fact that the things that you had to do to become a licensed and qualified therapist, in Michigan, or the things that a doctor has to do or a nurse has to do, it's the same general path. The exercise profession, particularly the exercise professional, is a newer profession, really starting in the early 90s. And so we're kind of in our, early teenage years right now as a profession, and we're learning how to put in place all of the regulatory pieces that we need to have in place in order for us to be underneath that healthcare tent.
Yeah. Now, one of the things I did recognize in the article is that you did mention, because those things have lacked, that often there's a high turnover rate. So you don't have fitness professionals that start on that trajectory that actually stay within that. I think you said, was it like only 20% actually continue on?
Yeah, the turnover is extraordinarily high for a lot of reasons. And I think most of it has to do with the fact that because of how our industry is currently structured, we'll say broadly the commercial fitness industry that employs these exercise professionals, it is a very minimally compensated type of a position. Most exercise professionals, I think, last time I checked, the median pay for exercise professionals around the country was, somewhere in the, $45,000 per year range. And yes, that's a reasonable income to make when you get right out of college and you don't have any other bills to pay that are significant or significant responsibilities. But pretty quickly, if that's the ceiling to your pay, which if that's not the ceiling's not very far past that in a lot of environments for exercise professionals, it just simply becomes financially unsustainable. And that's largely because the services that we render are cash pay to individuals that are already reasonably fit in a lot of cases, already reasonably healthy. We've really not tapped into the broader American public. I mean, traditionally the commercial fitness industry serves about 20 to 25% of the American public. And as we go down our professionalization path, as we gain access to populations that are more chronically diseased through referral from medical professionals, as we have different compensation mechanisms and reimbursement through insurance and HSAs and FSAs and all the things that you would see in traditional healthcare, that not only opens up the market in terms of the sheer number of people, but that also puts in place a stable reimbursement mechanism that would allow qualified exercise professionals to be paid at a commensurate level for the outcomes that they are delivering with regard to improving someone's health. And then that allows that median rate wage to raise up to hopefully a level that would be similar to what a health coach, physical therapist, nurse would be paid. And then that becomes more of a sustainable profession because the wage actually allows you to live a reasonably comfortable life while being an exercise professional.
Yeah. Now, something that came to mind when you were talking, it made me think of the reality that I have actually talked about and discussed with numerous people that I've had on my radio show and on my podcast, is the fact that I think, especially in the United States, if not throughout the world, we are a reactive country and we are not very preventative. We kind of, it's all about addressing issues because you're sick, not proactively keeping you well. And I do believe that probably contributes to the lack of respect and, I would say, seeing exercise as an option and not as a necessary part of your life that should be integrated from the time that you're able to physically move and throughout your entire life, seeing that exercise is a key component, physical activity is a key component and a necessary component to your life and your longevity. I think that contributes to, I would say, or has contributed to the lack of respect and I would think appreciation for those individuals that are committed, to helping their clients physically move and be well. What are your thoughts about that?
Yeah, the incentive structures in healthcare in America are not in place to favor prevention. Currently, the way our healthcare system is structured, and this gets right back to policy and systems issues, we are a fee-for-service healthcare system. So currently, right now, all healthcare providers, on an overwhelming basis, with some rare exceptions, are paid on the volume of service they provide, not on the value of the service they provide. So essentially, if you're sick, ill, or injured, if you go to the doctor, the more stuff they do for you and to you, the more they get paid. So that they are in a fee-for-service model that is volume of care based. And the result of that is that healthcare organizations are incentivized to push procedures, push interventions that are medical in nature, and the higher the dollar, the more profitable the intervention is for the healthcare system. This is why, one of the reasons why 17.5% of our gross domestic product in this country goes to healthcare, which is more than double any other industrialized nation on the planet. And we are not in the top 5, in many cases in the top 10 for healthcare outcomes globally. So we're spending more and we're getting less. Now, what started to happen is policymakers have started to realize this issue, in large part because the government is the largest payer of healthcare in this country through Medicare and Medicaid. And so what they're starting to realize is if we keep going down this path of pay for volume rather than pay for value and good health outcomes, it is literally going to strangle the economic capabilities of our country, because as that percentage of GDP goes up, and up, it starts to crowd out money we can spend on infrastructure, on education, on other social programs. And so the shift is starting to occur with the Centers for Medicare and Medicaid Services leading the charge to pay for value. So not how much you do to somebody, but how you drive better health outcomes with a given individual. And one of the ways they're doing that is they're saying, hey, XYZ health organization, we are going to give you a set amount of money every month to manage Angela's healthcare. And let's just say that's $1,000 a month. If you keep Angela really healthy through proper diet, good stress management, avoiding substances, good sleep, and through movement, and you only spend $50 managing Angela's care that month, you get to pocket that other $950. But if you don't do a good job managing Angela's health because you're not helping to do all those things, and she requires a bunch of medications and a surgery and 3 visits with a specialist, and it costs you $1,500 to manage her care for the month, you, healthcare organization, are on the hook for that other $500. So in that particular case, the healthcare system is incentivized by the value of the care they're providing, not by the volume of the care they're providing. And as things with Centers for Medicare and Medicaid Service go in this country, eventually they go that way with the private insurers, the Blue Cross Blue Shields of the world. So we are shifting from pay for volume to pay for value. It is a slow move because it's a very entrenched system, but the current healthcare system as it is structured is economically unsustainable. Again, almost 1 out of every $5 in this country is spent on healthcare, and almost every health system, even the most profitable health systems in this country, are operating off profit margins that are 1, 2, 3%. Many of them are operating off negative profit margins in a lot of cases, and they're subsidized. So we realize that we have to make this shift, and it's going to happen in the next 10 to 20 years in earnest. Like, I really do believe 20 years from now will be almost completely pay for value, where right now we're almost completely pay for volume. And this just really positions the exercise profession well to be able to insert itself as a qualified healthcare professional, because again, that is a lifestyle intervention for which there is no accountable provider for in healthcare at this point.
Mm-hmm. No, it's interestingly, there's a section in the article titled Apply It, which provides some action items for readers of the article. Can you talk about some of those action items for people listening that want to support this effort?
Absolutely. The first thing is to just stay informed. And I think that knowledge really is power, particularly, with an effort that is happening mostly on the policy and systems level. So I'll point people to really 3 different resources to stay informed. First, the American College of Sport Medicine on the exercise professional front is really doing a great job with some other organizations leading the charge. So I always encourage people to, at the very least, sign up for ACSM newsletters, but ideally become an ACSM member. Membership is very inexpensive, and you're able to get access to a number of different resources. The second place that I'll point people to is the Physical Activity Alliance's website. That's PAAmovewithus.org, PAAmovewithus.org. Sign up for their newsletter. It talks about not just the policy and systems change that we're referring to at the professionalization effort, but all kinds of amazing policies that are being worked on to make the active choice the easy choice in the country. And then the last thing is I would engage with the Coalition for the Registry of Exercise Professionals. They also put out communications. Their website is usreps.org, usreps.org. And that's something that if you're an exercise professional, you should be looking at that website to make sure you are credentialed by an organization that is part of the registry. If you're a healthcare professional listening to this and you're wondering, how do I determine if the exercise professional I'm referring to meets minimal competency standards? The answer is they're on the registry. And then if you're in the public and you're trying to ask that same question, how do I know if the trainer I might be working with meets kind of these minimal qualification standards? They're on the registry. So be informed. ACSM, Physical Activity Alliance, and the Coalition for the Registry of Exercise Professionals. And then I could say a lot of other things in terms of action steps to do, but the best action step I can give to exercise professionals that are listening to this right now, because that's the group that I primarily spend a lot of my time talking to, is it's time to think differently about our profession and what we are. For highly qualified exercise professionals, it's time to shift the paradigm from I'm an exercise professional working in shorts, tennis shoes, and a t-shirt to I'm a healthcare professional. I'm working in khaki pants, a polo shirt, and dress shoes. And I know that sounds like such a simple thing for me to say, but we know that perception is reality, and you don't see physical therapists that are the closest proxy we have to an exercise professional in healthcare right now they're not walking around in tank tops, tennis shoes, and shorts working with their patients. We need to start to conduct ourselves, hold ourselves to the standard of, and even the appearance of other healthcare professionals. Not saying we need to go run out and get lab coats and carry around stethoscopes. That's not necessary for this, but it's something that we can do. And then the last piece I will say, and this extends to people in the policy space, people in the research space, people in the exercise space, and just the public writ large in terms of what they demand from the exercise profession. We all need to be focused on how we take fitness outcomes, which is the stuff that the exercise professionals do, tie them to health outcomes very clearly. And we have a decent amount of that data right now. But then we need to go the last step, and we need to take that health outcome data that's derived from improving fitness, and we need to tie it to claims data. We need to tie it to the insurance cost of individuals. And believe it or not, Angela, right now, I can absolutely tell you that if you have cardiovascular disease, exercise will improve your cardiovascular disease. No one disputes that. What I can't tell you, or really no one can do a good job telling you right now, is that if you exercise to improve your cardiovascular disease, how much will that reduce your healthcare costs? And, this is an economic conversation, if nothing else. And, the exercise oncology space, the cancer space, is starting to get some of that actuarial data. And the falls prevention space is also starting to get some of that actuarial data where we're able to say, hey, if you exercise during cancer treatment, we know that it not only improves your health, but it also reduces the cost of treating you as a cancer patient by X number of dollars. And when you can start to do that, then you validate the ROI for what we're talking about. And from there, it becomes a really easy conversation with payers and providers because we actually have the economics of the equation to stand on rather than just the general message that, hey, exercise and physical activity are good for you.
Mm-hmm. Now, in the final couple minutes of today's interview, I did want to ask you something, and then I'm going to kind of give you an opportunity to kind of share some final thoughts before we end today. Now, interestingly, I have to admit something that I was not doing as I was not paying close attention to what when I go, say, to my primary care physician, or I go to different physicians, what they charge for specific things. And just recently, because a couple doctors, my primary care physician and ironically my dermatologist, switched to a new system, the information they were providing back in terms of receipt was much more detailed. And I was able to see how much they were charging. And you talk about volume versus value. I was shocked to see how much my insurance company is, well, and ultimately me, because I pay a large amount per month for that insurance that covers that. I was shocked to see how much I was being charged, or my insurance company was being charged for something that would take a minute or a few seconds to do. And so I don't even know that there's a question as much as it's almost just a comment, based on what you were saying. I'm actually excited to hear that you're expecting to see a shift to move in the direction of value versus volume. Because ultimately, I think that it even hurts the individuals that are fit and healthy. Because I imagine that a large reason why I'm being charged so much and why my insurance is so high is not because I'm well, it's because of the many individuals that are unwell and that have to require a number of services.
And that's, I have so many thoughts that I'll try to make very succinct. First off, it's okay that people that are healthier are paying for people that aren't as healthy in insurance. That's why insurance works, right? Like we all pay into our car insurance. We hope we never get in a car accident. But when we do, that money's there. So that part's okay. But here's what's not okay. And this is not a political commentary. This is policy commentary in my mind. I believe that healthcare is a fundamental human right. And most industrialized countries on this planet believe that healthcare is a fundamental human right. And as a result of that, all the citizens within their population have access to basic healthcare services. The way healthcare has evolved in this country, and we don't have enough time to go into the history of that, the way it has evolved, it's evolved primarily as a private enterprise. And the systems and the mechanisms for paying for healthcare in this country are so skewed because it is based in market capitalism. The insurance companies, many of them are for profit, so they have to make a margin to stay in business, and their margin in a lot of cases exists by either not paying claims or not paying as much for claims. So you've got the payers, the insurers that are doing one thing. You have the providers that are doing another thing, which is, hey, the more stuff we do, the more we get paid for. And everyone's kind of fighting a losing battle. This is why I firmly believe that every single American should have fundamental basic health insurance, and there should be one single payer, the government as a payer, and that will allow for more equitable access to healthcare. And what it will allow for are everyone to be paying the same rates for healthcare. Because the crazier thing, Angela, than what you were paid for a 1 or 2 minute thing is that the next person that walked into that doctor's office who had a different insurance company was going to pay a different amount for the exact same thing done. And if the American public really understood and can get under the hood of our healthcare system, they would be floored by the fact that, and this is the one piece of history I'll give in this discussion, that our current modern day healthcare system came out of wage controls back during World War II. During the World War II period, the federal government said we needed to control wages so our men can go off and fight in World War II. And at that point in time, the legislation they put in place tied healthcare to people's jobs. And that was the inflection point that created this tsunami of just economic misincentives that have put us at the current healthcare state we're at right now. The reason we're at such a high amount of our gross domestic product going towards healthcare, I think has its roots in not having some kind of a nationalized healthcare system that is single payer in nature, where everyone gets some fundamental level of care. And again, that is a policy comment on one level, but I also think it is a moral comment saying that healthcare, basic healthcare, is a fundamental human right for everyone. And in this country, if we're going to really have life, liberty, and the pursuit of happiness, the element at the end of that equation is everyone has access to their basic healthcare needs.
Thank you. Thank you for saying something that needed to be said.
Yeah.
Truly, truly. Any final thoughts?
I would say that this kind of stuff is a lot to think about, right? Like, particularly if you're first hearing these things for the first time. And so don't get caught up too much in some of the deeper details that I talked about. If those details interest you, by all means, please learn about them. Knowledge is power. But I think my takeaway for everyone from this is just be informed. I gave some resources that people can reach out to. You can certainly link up on that show notes page. But I think the one thing to remember from this whole discussion is that movement on a minute-by-minute basis is the most productive and efficient thing you can do for your health. Remember, that 150 minutes a week can be very powerful. But the biggest improvements that people see in health aren't when they go from 135 minutes a week to 150 minutes a week. It's when they go from 0 minutes to 10 minutes, or from 10 minutes to 20 minutes. So going from, nothing to something, or from a little to a little bit more, can have profound improvements in your health. And that is something you don't need a research study to tell you. If you just go do it, or if you work with the people that are out there that aren't moving enough, if you apply that type of an approach to them, you will see profound improvements in your health. Movement really is medicine.
Most definitely it is. Well, thank you so much for taking time out of your day to share something that I always say with my guests, your purpose and passion, with me and with my listeners. And I can definitely tell that you're very passionate about what you do. And I think it takes passion to be a catalyst for change. So thank you for being the necessary change that we need, not just in the fitness industry, in the wellness industry. It's something that, as you mentioned, I think that health, and you didn't frame it this way, but I think that health is a human right, and access to the resources, the information, the right professionals, qualified professionals. I think it's a right for everyone. Mm-hmm. And unfortunately, it's not something that is always guaranteed. It's largely determined by a number of factors that we could talk about all day. Mm-hmm. But I do thank you so much for your passion. And I do believe that it takes individuals like you that are so passionate, as I said, to be a true catalyst for change. So thank you.
Thank you so much.
Thanks for listening to Empower It with Angela T. Moore. Feel free to share this episode with someone you think would enjoy it. New episodes come out weekly. Follow our show on Apple, Spotify, YouTube, or wherever you're listening right now.